Thank you for waiting. This brings us to have our first keynote speech delivered by Ms. Samira Asma, Assistant Director General for Data Analytics and Delivery at the World Health Organization. Ms. Asma is leading the WHO's effort to use timely, reliable, and actionable data in pursuing organizational and global agenda, including the SDGs. Before joining the WHO, Dr. Samira served in leadership position in the U.S. Center for Disease Control and Prevention for over 2 decades, contributing national and global programs on non-communicable diseases, environmental health, tobacco, and more. Dr. Asma has contributed to more than 100 publications, books, and policy papers on global health and public health surveillance, whose scientific and policy expertise is internationally recognized. Due to time difference, she couldn't join us real time. However, this pre-recorded keynote speech delivered by Dr. Asma can provide a good opportunity to share her insights. Allow me to steer your attention to the screen.
Hello, colleagues. I'm delighted to welcome you to the 2021 International Conference on Official Statistics. This conference comes at a pivotal moment, one where we have the chance to turn crisis into an opportunity if we act together with speed and at scale. And more importantly, to be better prepared when the next crisis strikes with real-time, reliable, and actionable data and country capacity to predict, detect, and respond to any health emergencies. COVID-19 has shown that inadequate data has hindered our ability to prepare and respond to health emergencies, not only at a global level, but at national and local levels as well. The pandemic is not the first crisis, nor will it be the last, and we must have the data and statistical systems that are agile, integrated, and responsive. To accurately and consistently report on the Sustainable Development Goals, every country requires several functioning data systems that must speak to one another, such as the household health surveys, census, CRVS, and administrative data, and so on. WHO recently conducted a global assessment of data and health information system capacity in countries. The report found that over 50% of countries lacked good capacity for surveillance, and only 27% have sustainable capacity to survey public health threats. It also found that 40% of deaths worldwide remain unregistered. So this begs a question: how can we prevent future emergencies if countries still cannot count deaths and report on causes of death? A recent study from the World Bank and the United Nations further showed that 65% of the National Statistical Organization headquarters are either partially or fully closed as a result of the pandemic, with 90% of staff working from home and 96% partially or fully refraining from in-person data collection. If governments don't know where vulnerable populations live, what people are dying from, how old they are, or what their health status is, it is truly impossible to deliver the right interventions, such as vaccines, to the right people at the right time, at the right place. It also means that inequalities that existed before COVID-19 are being exacerbated. A new WHO global dashboard on COVID-19 vaccine equity finds that low-income countries would add more than $38 billion to their 2021 GDP if they had the same vaccination rates as the high-income countries. So there is a big inequity gap that we see globally. Understanding precisely where the gaps are and how to address them requires access to and use of new data sources. In other words, it requires going beyond official statistics to strike the right balance between data sharing and protection and ensuring impartial, independent national statistical organizations that are integrated with all sectors, including health sector. As I often say, we should be able to check the latest health data the same way we check weather every morning. Data gaps and fragmentation are not new, but they are increasingly costly and threaten the lives and livelihoods of millions of people around the world. Today, on this occasion, I would like to highlight 3 lessons and promising solutions for how to address the issues that we are facing and get back on track towards the 2030 agenda. Not only get back on track, but accelerate our progress to achieve the Sustainable Development Goals. First, governments must invest in basic civil registration and vital statistics capacity at local and national level to count every birth and death in both health facilities and in the communities. WHO and UNICEF recently launched a joint guidance on the role of the health sector in making every birth and death count. The health sector is a critical ally of the national statistical organizations with a unique multi-sectoral network reaching to the community levels. A new CRVS strategic implementation plan for 2021 and 2025 has also been prepared to support countries in mobilizing their health sector to lead and contribute to the CRVS system strengthening, with several countries prioritized for the coming year. In addition, we recently hosted an expert consultation on WHO's new multi-mode, multi-topic, and multi-platform survey system, the World Health Survey Plus, which will provide much-needed solutions to bridge diverse data sources and adapt global tools to local contexts. National statistical organizations working together with ministries of health will play a key role in implementing the World Health Survey Plus and ensure these surveys are representative, low cost, and country-owned. Another key lesson is the importance of investing in data infrastructure and digital technology. Routine information systems cannot be isolated from the wider national systems. In other words, health data must be able to talk to tax data, for example, or education, workforce data, and finance, and more. This is what we have termed national data infrastructure. And a key component of this is having a set of unique identifiers for individuals by space and location. At the World Health Organization, we are supporting these efforts through forums like the Health Data Collaborative and the SDG Global Action Plan, which works to align technical and financial resources with country needs. In addition, we recently hosted the first of the multi-series Health Data Governance Summit to address key challenges and share best practices to support the use of data as a global public health good. And we invite you all to join us for the next session on 30th of September. Finally, the third key lesson is the importance of public-private partnership. Working collaboratively with all sectors is so crucial to ensure data systems are integrated and interoperable and that solutions are implemented seamlessly. One example of this is WHO's partnership with Microsoft, Avanade, and Esri and many other technological companies to develop the new World Health Data Hub, an end-to-end digital destination for countries, partners, and all global health stakeholders to access and use real-time health data. The hub will increase the transparency and speed of data collection, monitor inequalities through disaggregated data, and enable the use of data to drive policy dialogue and impact in countries. Earlier this year, we released the results of the first use case for the hub. COVID-19 global excess mortality estimates were developed through a group of global experts to reflect both the direct and indirect impact of the pandemic on mortality. And our assessment indicated that 1.2 million more deaths occurred as a result of COVID in 2020 than officially reported. And we are now working with countries and partners on modeling and estimating nationally and plan to release these estimates by the end of this year. So we will have a better understanding of the true and the tragic human toll of the pandemic. My three key messages can be summarized with a call for all countries to move from national statistical systems to national statistical and data systems. This will ensure that we incorporate unconventional data sources, show bold leadership in bridging big data with citizen science, and use the power of machine learning and artificial intelligence to draw insights and respond effectively. While there is already a broad consensus, what is needed now is that we must urgently operationalize to leverage the potential of innovation and keep pace with the rapid changes to data ecosystem. This includes echoing our collective support for a new global data convention alongside the statement on data as truly a global public good, to instill confidence in data sharing, data protection, and use, and support our common goal of more timely, reliable, actionable, and accessible data for all. I and all colleagues at the World Health Organization are committed to closely working with you to promote health, keep the world safe, and serve the vulnerable in line with Dr. Tedros's vision to transform the World Health Organization into a truly modern, data-driven enterprise to serve all countries. Thank you so very much.